a lot of you are in case management right now for your clinical, and it's been really interesting. So an important role of the nurse in community health is that of the client advocate. The goal of advocacy is to promote the client's self-determination. And self-determination is the goal's ability, or the patient's ability to make decisions for themselves, to find out what's going on, assess all sides of the decision, and then make said decision. When performing the advocacy role, conflicts may emerge regarding the full disclosure of information, territoriality, accountability to multiple parties, legal challenges to clients' decisions, and competition for scarce resources. The function of advocacy and allocation can pose dilemmas in practice. Skills important in fulfilling the role of client advocate include the helping relationship, assertiveness, and problem solving. Problem solving is a systematic approach that includes understanding the values of each party and generating alternative solutions. Brainstorming and the problem purpose expansion method are two techniques to enhance the effectiveness of problem solving skills. During conflict, negotiations can move conflicting parties toward an outcome. Care management is a strategic program to maintain the health of a population enrolled in a healthcare delivery system. I am very sleepy and I apologize. Case management is a strategy that's used in an overarching process called care management. So care management is an enduring process in which a population manager establishes systems that monitors the health status, resources, and outcomes from an aggregate. So basically, the aggregate is the patient. And the patient is within a population. The case manager establishes what they're going to monitor. And for us, the health status is the resources available to maintain said health status, and then what can the outcomes be? And what should the outcomes be? That's something that's important. Setting goals for the case manager so that she can direct the aggregate to the correct resources. So, for example, if you're a chronic care case manager, you want to prevent ER and hospital admissions. So what can you do to prevent that? Somebody has COPD, making sure they're on the right medications, they're seeing a pulmonologist, they're getting pulmonary rehab. Are they on oxygen? Do they have enough oxygen tanks? Do they know how to use their oxygen? Do they have backup generators? Do they have travel oxygen kits with them? Are they still smoking? Is there smoking cessation program that they can be a part of? And I mean, these outcomes, what's scary nowadays is that some of these outcomes, if they're not met, the provider and the healthcare aggregate, such as the case manager, get dinged on it, and it's not fair because you could do everything, provide all the resources possible, and still, the patient is successful. So we'll see if that gets recognized as these new benchmarks are set. So building blocks used by case managers. So there's risk analysis, and that's looking at the patient's actual risk and seeing where they stand. So are they fall risks at home? Are they risk for not achieving their goal? What's their hospital admission risk? What's their risk of mortality, morbidity? Data mapping. So getting all their data and collecting it and grouping it into certain categories. And then monitoring their data for health processes, indicators, and unexpected illnesses. Something that's important is epidemiologic investigation of unexpected illnesses. So somebody gets a pneumonia, looking back, did this person get their Pneumovax? Did they get the new Penicillin? Or, sorry, there's Pneumovax, and what's the other one? Pneumovax and the polysaccharide, Penicillin. I said that, didn't I? Sorry. Getting both their vaccines. Maybe they're living in a home that has a lot of mold and they end up getting a weird pneumonia. Are they in a place that has a lot of TB? Are they getting exposed to certain diseases? And then a multidisciplinary development of action programs. Identifying case management triggers or events that promote earlier referrals to high-risk clients eventually can have dramatic results. So care management is a program or process that establishes systems and monitors the health status of individuals, families, and work groups. The program or process develops planning and intervention activities as well as targeted evaluation outcomes for the client group. Oops, sorry. This includes the following strategies: use management, critical path, disease management, demand management, and case management. Case management includes the activities implemented with individual clients in the system. A case manager builds on the basic functions of the traditional role and adapts new competencies for managing transitions from one part of the system to another. Coordinating, conscious activity of assembling and directing the work efforts of a group of health providers so that they can function harmoniously in the attainment of the objective of client care. Advocacy, activities for the purpose of protecting the rights of others while supporting the client's responsibility for self-determination. This involves informing, supporting, and affirming a client's self-determination and healthcare decisions. Case management is complex because of the coordinating activities of multiple providers, payers, settings throughout a client's continuum of care. It's really more complex in rural settings because, most likely you're going to have a specialist in the closest city. They're most likely not going to be in the same EMR. You're transferring papers back and forth to each other. It's really hard for patients to get rides out there, so you're coordinating that. Through nurses' case management activities, the general community weakness in quality and quantity of health services are often discovered. repetitive, time-consuming, and costly. Knowledge and skill requirements. Knowledge of community resources and financing methods, written and oral communication and documentation skills, negotiation and conflict resolution, critical thinking processes to identify and prioritize problems from the view of the provider and client, application of evidence-based practices and outcome measures. Alright, the tools of case managers, telehealth, so doctors and first responders being able to treat their patients via Skype, and also them being able to talk to their patients via Skype. The 5 rights of case management, which are the right care, the right time, the right provider, the right setting, and the right price. The right setting is very important. Some people can't leave the home. Some people need to be seen in a facility. Some people can only be seen by a female doctor or a male doctor, or they need a family present. Case management plans, disease management, and life care planning tools. So knowing implementation of full code, do they have an advanced directive? If they have an advanced directive, what's in it? Do they need to reassess every few weeks? Do they have a plan for hospice? Do they have a plan if they're going to stay at home or if they're going to go to an assisted living, and when and who is going to make that call? Community models of case management, there's Liberty Mutual Insurance Company, there's telephone-based collaborative care, and then state government agency. So the nurse advocate will make the client's rights the actual priority, and that's really important. What rights do they have as an elderly person? What needs do they have as they have chronic disease management or acute care, or what a child's needs are, or what their rights are? Aim to promote self-determination in the client group, processes of advocacy. Case managers need help. Case managers help clients manage conflicting needs and scarce resources. So when Medicaid says I'm not going to pay for your dentures, case managers help settle those conflicts. There's mutual benefit with limited loss for everyone, and that is the goal of conflict management. So some techniques are negotiating, assertiveness, and cooperation. Using a range of active communication skills directed toward learning all parties' needs and desires is really important. And you want to detect areas where there's going to be agreement and disagreement. You can use that as part of your negotiating tactic. So, determining abilities to collaborate. Who will collaborate, who can, who are the best areas to collaborate with. Assisting discovering alternatives and valuable activities for reaching a goal. Collaboration skills for case management. Goals to promote respect, understanding, and accuracy of communication of all team members' points of views. You need knowledge and skills about the client, their health status, the resources they have, the treatments they need and had, what community providers are available, the client's and family's complex needs, and what they're able to give. Intrapersonal, medical, nursing, and social dimensions, and then team members and leadership skills. assessment, planning, coordination, referral, monitoring, evaluation. Nurses in community health have advocacy and case management functions within their scope of practice. Alright, so here are some questions to go through. So, alright, identify the 8 items in which teamwork and collaboration demand knowledge and skills. Okay, the answer are, teamwork and collaboration clearly demand knowledge and skills about the following: clients, their health status, their resources, treatments available, what community providers can they go with, clients and their families' complex needs, interpersonal, intrapersonal, medical, nursing, and social needs, what dimensions, and team member leadership skills. So which of the following are strategies of care management? Use management, case management, critical pathways, or all of these? answer is E, all of them. The local regional medical center is partnering with the home health agency to provide disease management to frequently admitted patients with congestive heart failure. The administration of the medical center has identified that there are multiple readmissions every month to the same unit. Core measure data indicates that appropriate medical intervention and nursing education has been conducted repeatedly with those patients who continue to seek medical care. The home health agency is collaborating with the cardiac telemetry unit to identify patients being discharged with the diagnosis of CHF. A case manager is assigned to make follow-up phone calls daily to monitor signs and symptoms of exacerbation. A home health nurse may be assigned to visit the patient if criteria is not met. So what are some anticipated outcomes of CHF disease management? So, interrupted development of disease. We want to reduce emergency department visits and fewer inpatient days. And we want greater client and provider satisfaction. So clients with chronic disease benefit from a disease management approach. The goals are to interrupt continued development of a disease and prevent future disease and complications through secondary and tertiary intervention. So the core measures after a heart attack are putting the patient on a beta blocker. Why? What does the beta blocker do? So the idea behind the beta blocker, if you have patients with heart disease, if you have heart disease, it's going to signal, and some kidney failure, it's going to signal the sympathomimetic response, which will increase vasodilation, increase perfusion to the kidneys, which will then also release more and more aldosterone that will cause further damage to the heart. It also makes the heart work harder because of the catecholamines and increased oxygen demand. Another thing that we do is we put a patient on ACE inhibitor. Why? Because it's renal and cardioprotective. It protects patients from aldosterone. It prevents remodeling of the heart. What are some other options? What are some other measures? Initiate tobacco cessation. This is so important. We know that tobacco products, not just smoking, but also dip, vaporizing, pipes, even the gum after a while, has cardiotoxic effects, right? It increases the risk for stroke and heart attack. So what do we do about this? We implement smoking cessation. Most states have free or supplemented aids to help people quit smoking. I know even at the health department, we give Chantix for free because we really want to get our patients to stop smoking. Cholesterol management. So most of these patients are put on a statin unless it's contraindicated. Even if for some reason which is really rare, their cholesterol seems under control, we'll still put them on a statin to prevent any chance that there's plaque building. And if we can get people's HDL up. Now, there's a lot of humming and hawing about whether medication to control HDL and triglycerides are actually efficacious, but this can be changed with fiber diet and increased exercise. So we want to get someone on an exercise program. Cardiac rehab is usually the main thing. Controlling blood sugar, so checking for diabetes and keeping tight glycemic control is another core measure. Promotion of wellness is necessary for success. For specific client populations that consume a disproportionate share of the resources, disease management programs allocate their correct resources in an efficacious manner. Disease management programs also reduce emergency room department visits, results in fewer inpatient days, greater client satisfaction, and reduced school absences. As the science of disease management evolves to predict direct relationships between outcomes and protocols of care, case managers will be able to ensure cost-effective, optimal clinical care across the curriculum. Let's see, what is another core measure? Bring it to your mind. for heart failure, it's a few other ideas would be like calling your patient or calling your doctor if you need more than 2 pounds, problems breathing, go to the ER, making sure there's an echo on record. So anyway, those are kind of part of those core measure pathways that are really important. be advantageous to the client without funding. B. Excessive attention to containing costs supersedes or impairs the nurse's duty to improve health or relieve suffering. C. A client is in end stages of congestive heart failure but is led to believe that treatment will continue to be beneficial. Or D. The client's preferred provider is no longer contracted with insurance company and the client is forced to choose another provider. So we're talking about the principle of justice. Justice is an ethical principle for case managers, and this considers equal distribution of health care with reasonable quality. Tiers of quality and expertise among provider groups will be created when quality providers refuse to accept reimbursement allowances from the managed system, leaving less experienced or lower quality providers as the caregiver of choice for clients being managed. So the answer is A. What are some of the benefits of the use of telehealth when dealing with the case management of disease processes? So the client's able to be seen and treated in the comfort of their own home. The nurse is able to provide advice, counseling, and referral. And telehealth provides some alternatives within resource delivery options. Case management practice is complex because of the coordinating activities of multiple providers, payers, and settings throughout a client's continuum of care. Care by multiple providers, the client, family, significant others, community organizations must be assessed, planned, and implemented, adjusted and based on mutually agreed upon goals. The nurses employed and located in one setting will be influencing the selection and monitoring of care provided in other settings by formal and informal care providers. With the use of electronic care delivery through telehealth activities, case management activities are now delivered via telephone, email, or text. So how would you describe community? target of practice. Which of the following best describes the activities of this nurse? Providing care to an active caseload of 50 families in the neighborhood, inviting all the parents of asthmatic children to meet together, sharing assessment, finding, and health goals with every community group that will listen, or writing articles for the local newspaper, highlighting various programs and services of the local health department. So sharing assessment findings and health goals with every community and group that will listen. Persons often point out that smokers choose to light their cigarettes, alcoholics lift the glass to their mouth, and drug addicts inject or ingest their drugs. Which of the following statements best describes why nurses don't simply focus on helping persons who engage in poor health behaviors? And that's, society has to offer healthy choices, offer support, and practice helpful policies. So what factors should a nurse consider when deciding which alternative intervention should be